This weekend, the Senate passed the Inflation Reduction Act. The $740 billion package includes capping out-of-pocket prescription drug costs for seniors, helping Americans pay for private health insurance, and an investment to fight climate change. It will all be paid for with new corporate taxes, including a 15% minimum tax on big corporations to ensure they don't skip out on paying any taxes at all. What's not included is an insulin price cap for diabetes patients with private insurance. The package cap insulin prices at $35 a month for Medicare patients, but the price cap for Americans with private insurance was stripped from the bill by Republican lawmakers. The price of insulin is an issue impacting millions of Americans, like Joshua Davis, a 13-year-old from Virginia. He's been pushing for lower prices and was spotlighted by President Biden during his State of the Union address when the president made this claim.
Insulin costs about $10 a vial to make. That's what it costs the pharmaceutical company. But drug companies charge families like Joshua and his dad up to 30 times that amount.
So why does insulin cost so much, and does it really cost as low as $10 to make? We verify.
Where's the ghost? Oh no.
Ali Popel works 3 full-time jobs.
Excuse the mess as always.
At an IT company, as a realtor,
Dinosaurs coming.
Whoa.
and as a dad.
This is my son Aaron. He is now 11 months.
But to do anything, he first needs to make sure that his glucose is in check.
I'm type 1 diabetic. I'm insulin dependent, so my pancreas does not produce any insulin.
Without it, he could go into what's called diabetic ketoacidosis, or DKA, which could lead to a coma. So this is life-saving. It's food, water, insulin for
I need it like oxygen, yes.
And right now, Ali is paying under $50 to get 5 vials of insulin. But back when he was unemployed and uninsured, he says he would pay anywhere from $400 to $800 per month, which is why he wants to know.
Why does it cost so much?
So let's verify. What explains the cost of insulin? For answers, we spoke with Gerard Anderson, a professor at Johns Hopkins University.
It's a very, very complicated supply chain.
And Dr. Robert Lash, the chief medical officer at the Endocrine Society. Our team also read this 269-page report from the U.S. House Oversight and Reform Committee and watched a 2019 congressional hearing on this exact subject. And according to our 2 experts, $10 to $25 is a fair estimate of the cost to create insulin. Although Dr. Lash referenced this study, which says that a vial of insulin could cost less than $8 to make. As for the price tag, well, that's complicated.
It doesn't make any sense. You're trying to make sense out of something that makes no sense.
Anderson explains there's limited competition. In fact, according to that House committee report, just 3 drug companies make up 90% of the global market. And here are their list prices. About $275 for Humalog, made by Eli Lilly. About $284 for Lantus, made by Sanofi. And almost $290 for Novolog, made by Novo Nordisk. But these list prices set by the manufacturer are just the first piece of the puzzle. Insurance companies will then negotiate a lower price through pharmaceutical benefit managers, or PBMs. Our experts say they decide which drugs get a favorable placement on what's called a formulary, which is essentially the list of drugs your insurance will cover. So making these PBMs happy with big rebates is a huge deal for the pharmaceutical companies.
There's been this dance where the rebate goes up, the price goes up, the rebate goes up, the price goes up.
And if you have good insurance, this dance may not impact you much. You only see that reduced price, but it's a different story for those with a high deductible.
Until they've incurred $3,000, $5,000, $10,000, they're going to have to pay the list price, unless their insurance somehow has negotiated something for them, but that's not common.
As for those with no insurance at all, our experts say that they're often going to have to really pay up.
If you don't have insurance at all, you're going to be paying list price.
And Medicare patients who don't have Part D, the prescription drug plan, could be in the same boat. Now, our team did reach out to the 3 pharmaceutical companies and listen to their 2019 testimony.
List price is only part of the story.
They essentially argue that the list price is a red herring because it doesn't factor in the big rebates, adding that there are also discounts available for those with and without insurance. Although you have to apply for these discounts, and it's up to the pharmaceutical company if you're going to be approved. So we can verify that for the uninsured or people with a high deductible, the answer is yes. They would have to pay hundreds of dollars unless they get a discount.
What is that, right?
A shark.
Back in Alexandria, Popel says that he hopes the price of this important medicine will only go down from here.
You need it. If you don't have it, you're going to be hospitalized.
And we should note there are cheaper alternatives out there, some released by these big pharmaceutical companies, others through partnerships with major retailers like Walmart. There's even a new nonprofit looking to release low-cost insulin as early as next year. For children navigating type 1 diabetes, constant blood sugar monitoring can be difficult for an active lifestyle. Researchers in England say there's new evidence that an artificial pancreas can help control blood sugar levels in young children better. Ian Lee has more on the technology parents are calling life-changing.
8-year-old Eddie is juggling a lot in his life: school, sports, and his type 1 diabetes. It's a handful for his parents, too.
When you get a child who has been diagnosed with diabetes, it is really, really obviously very scary.
Eddie's family says managing his glucose levels has been a difficult 24-hour job, testing his blood 12 times a day and injecting insulin.
Yeah, my fingers got a little bit sore from having it a lot of times.
And you have this cannula.
Now a team at Cambridge University in England has found an artificial pancreas may be better than traditional treatment at controlling the disease in very young children.
So there's 3 components to the closed loop. So there's the glucose sensor, the app on the phone, and the pump.
Current treatment requires parents to manually adjust insulin levels, but the wearable technology replaces the constant poking and prodding.
And then it automatically calculates how much insulin should be given to get the glucose levels to the healthy range. And it then tells the insulin pump how much insulin to give.
Get more time.
Other artificial pancreas systems have been developed around the world. Cambridge researchers tested their technology on children ages 2 to 7 and found blood sugar levels were stable for longer.
And particularly overnight, more than 80% of the time, the glucose levels were in the healthy range.
Giving Eddie and his family their lives back.
I can bounce on trampoline, I can play with my dog. I couldn't do anything, but now all I have to do is have some insulin or have something to eat, then I can go back to playing.
And enjoying just being a kid.